Effective and professional documentation is an essential aspect of providing care for individuals with developmental disabilities. Documentation serves as a record of care provided, helps track progress, ensures compliance with regulatory standards, and safeguards both the care recipient and the caregiver. It requires clarity, accuracy, consistency, and objectivity, forming the backbone of quality care practices. Clarity is foundational in documentation. Descriptions of care should clearly reflect what occurred, leaving no room for ambiguity. Rather than using vague or general terms, care staff should describe specific actions and responses. For example, instead of writing, "The individual seemed upset," a clearer statement would be, "The individual paced the room quickly, spoke loudly, and expressed frustration about missing their favorite activity." Accuracy is paramount to reliable documentation. Information recorded must truthfully reflect events as they occurred, without exaggeration or omission. It's essential to avoid assumptions or interpretations not supported by observable facts. If an event was not directly witnessed, it should be clearly noted as reported by someone else. This helps maintain trustworthiness and accountability in documentation. Consistency across documentation enhances its reliability and usefulness. Consistent use of terminology, descriptions, and formats makes records easier to interpret, especially when multiple staff members are involved in providing care. Using standardized forms or templates can help maintain this consistency, ensuring that vital information is always included and easy to locate. Professionalism demands objectivity and neutrality in all documentation. Personal feelings or opinions should never influence how care activities or behaviors are described. Objective documentation means reporting observable facts without judgments. For instance, rather than writing, "The individual was being difficult," staff should state clearly, "The individual refused assistance 3 times and raised their voice." Timeliness significantly impacts the effectiveness of documentation. Recording information as soon as possible, after care has been provided, ensures accuracy and detail. Delays in documentation can lead to forgotten details, inaccuracies, or confusion, all of which can negatively affect future care planning and the individual's overall well-being. A comprehensive approach is also necessary. Documentation should include not only routine tasks and observations, but also any unusual occurrences or incidents. Clearly documenting interventions used, their effectiveness, and any follow-up actions taken provides valuable insights for ongoing care planning and quality improvement. Consider the scenario of Maria, a care provider working with James, an individual with developmental disabilities. One morning, James refused to eat breakfast, appearing agitated and verbally expressing anxiety about a doctor's appointment scheduled later that day. Maria calmly reassured James, gave him space, and offered alternative activities to help him relax. When documenting this event, Maria accurately noted James's specific behaviors, his verbal statements, and her own interventions. She included how James responded to these interventions, ensuring her documentation was clear, objective, timely, and thorough. Confidentiality and privacy must be diligently maintained in all documentation. Sensitive information about individuals should only be accessible to authorized personnel. Care staff must follow established guidelines for protecting documentation, both physical and electronic, to prevent unauthorized disclosure or breaches of privacy. Finally, regular training and review are crucial in maintaining high-quality documentation standards. Ongoing education helps care staff remain aware of best practices, changes in regulations, and evolving standards of care. Periodic reviews of documentation practices can also identify areas for improvement, fostering continual growth in professional caregiving and documentation skills.